Welcome to this channel, your hub for educational content on medicine, pharmacy, and health, aimed at empowering your learning and practice. Today, we're diving into an engaging session of the Pharmacology Quiz Series, focusing on the topic of anticholinergics. If you'd like to reinforce your understanding, be sure to check out our companion video providing an overview of the key concepts of anticholinergics. The link is in the description below. In this quiz, we'll explore 10 multiple-choice questions related to anticholinergics. Each question comes with 5 options, and only one of them is correct. After revealing the correct answer, we'll discuss why it is correct and explain why the other options are incorrect. Let's get started. Question 1. What is the primary mechanism of action of non-depolarizing neuromuscular blockers like vecuronium? Option A, blocking acetylcholine release from presynaptic terminals. Option B, antagonizing acetylcholine at nicotinic receptors. Option C, inhibiting acetylcholinesterase activity. Option D, prolonging depolarization at the motor endplate. Option E, increasing acetylcholine release. The correct answer is option B, antagonizing acetylcholine at nicotinic receptors. The explanation is as follows: non-depolarizing neuromuscular blockers like vecuronium work by competitively antagonizing acetylcholine at nicotinic receptors on the motor endplate, preventing depolarization and subsequent muscle contraction. This leads to skeletal muscle relaxation, which is essential during surgical procedures requiring paralysis. Here is the explanation for the incorrect options. Option A is incorrect because these agents do not act presynaptically to block acetylcholine release. Option C is incorrect because inhibiting acetylcholinesterase would increase acetylcholine levels, counteracting the blockade. Option D is incorrect because prolonging depolarization is the action of depolarizing agents like succinylcholine, not non-depolarizing blockers. Option E is incorrect because these drugs do not enhance acetylcholine release, they block its effect at the receptor level. Question 2. Which muscarinic receptor antagonist is commonly used in ophthalmology for pupil dilation during eye examinations? Option A, tiotropium. Option B, tropicamide. Option C, oxybutynin. Option D, ipratropium. Option E, tolterodine. The correct answer is option B, tropicamide. The explanation is as follows: tropicamide is a muscarinic receptor antagonist that causes temporary pupil dilation, mydriasis, by relaxing the sphincter pupillae muscle in the eye. Its short duration of action makes it ideal for diagnostic procedures in ophthalmology. Here is the explanation for the incorrect options. Option A is incorrect because tiotropium is used for respiratory conditions like COPD and does not affect the eye. Option C is incorrect because oxybutynin is used to treat overactive bladder, not for ophthalmologic purposes. Option D is incorrect because ipratropium is a bronchodilator and has no role in pupil dilation. Option E is incorrect because tolterodine is also used for bladder control issues, not eye examinations. Question 3. Which of the following is a potential adverse effect of anticholinergic agents used to treat overactive bladder? Option A, diarrhea. Option B, dry mouth. Option C, increased lacrimation. Option D, hypotension. Option E, bradycardia. The correct answer is option B, dry mouth. The explanation is as follows: anticholinergic agents reduce parasympathetic activity, which can decrease salivary secretion, leading to dry mouth. This is one of the most common side effects due to their systemic inhibition of muscarinic receptors. Here is the explanation for the incorrect options. Option A is incorrect because anticholinergics tend to cause constipation, not diarrhea. Option C is incorrect because they reduce tear production, causing dry eyes, not increased lacrimation. Option D is incorrect because hypotension is not a typical side effect, anticholinergics often increase heart rate. Option E is incorrect because they generally cause tachycardia, not bradycardia. Question 4. In a patient with myasthenia gravis, which of the following agents is most appropriate to reverse the effects of non-depolarizing neuromuscular blockers after surgery? Option A, pyridostigmine. Option B, scopolamine. Option C, glycopyrrolate. Option D, pralidoxime. Option E, atropine. The correct answer is option A, pyridostigmine. The explanation is as follows. Pyridostigmine is an acetylcholinesterase inhibitor that increases acetylcholine levels at the neuromuscular junction, effectively reversing the competitive blockade caused by non-depolarizing neuromuscular blockers. It is particularly effective in patients with myasthenia gravis who already have compromised neuromuscular transmission. Here is the explanation for the incorrect options. Option B is incorrect because scopolamine is primarily used for motion sickness and has no role in neuromuscular blockade reversal. Option C is incorrect because glycopyrrolate is an anticholinergic used to reduce secretions, not to reverse neuromuscular blockers. Option D is incorrect because pralidoxime is used to treat organophosphate poisoning, not to reverse neuromuscular blockade. Option E is incorrect because atropine is an anticholinergic that does not restore neuromuscular function. Question 5. Which of the following statements about depolarizing neuromuscular blockers like succinylcholine is correct? Option A, they act as competitive antagonists at nicotinic receptors. Option B, they can cause prolonged paralysis in patients with pseudocholinesterase deficiency. Option C, their effects are easily reversed with acetylcholinesterase inhibitors. Option D, they are primarily metabolized by the liver. Option E, they have a slower onset of action than non-depolarizing agents. The correct answer is option B. They can cause prolonged paralysis in patients with pseudocholinesterase deficiency. The explanation is as follows. Succinylcholine is rapidly hydrolyzed by plasma pseudocholinesterase. However, patients with pseudocholinesterase deficiency cannot metabolize the drug efficiently, resulting in prolonged neuromuscular blockade. This genetic variation can have significant implications in clinical practice. Here is the explanation for the incorrect options. Option A is incorrect because succinylcholine acts as an agonist, not an antagonist, at nicotinic receptors. Option C is incorrect because acetylcholinesterase inhibitors do not reverse succinylcholine's effects during its depolarizing phase. Option D is incorrect because succinylcholine is metabolized by pseudocholinesterase in the plasma, not the liver. Option E is incorrect because succinylcholine has a rapid onset, faster than non-depolarizing agents. Question 6. A 45-year-old farmer is rushed to the emergency department after being exposed to an organophosphate pesticide. He exhibits symptoms of excessive salivation, bradycardia, and meiosis. What is the most appropriate first-line treatment? Option A, pyridostigmine. Option B, pralidoxime. Option C, atropine. Option D, neostigmine. Option E, glycopyrrolate. The correct answer is option C, atropine. The explanation is as follows. Atropine is a muscarinic antagonist that counteracts the excessive cholinergic activity caused by organophosphate poisoning. It blocks the muscarinic receptors, relieving symptoms like bradycardia, salivation, and meiosis. Here is the explanation for the incorrect options. Option A, pyridostigmine is incorrect because it is a cholinesterase inhibitor, which would worsen the cholinergic crisis. Option B, pralidoxime is incorrect because, while it reactivates acetylcholinesterase, it is not the first-line treatment. Option D, neostigmine is incorrect because it also inhibits cholinesterase and would exacerbate symptoms. Option E, glycopyrrolate is incorrect because it is less effective in crossing the blood-brain barrier compared to atropine. Question 7. A patient with chronic obstructive pulmonary disease, COPD, requires a muscarinic antagonist inhaler. Which of the following is most appropriate? Option A, glycopyrrolate. Option B, tiotropium. Option C, scopolamine. Option D, tropicamide. Option E, pilocarpine. The correct answer is option B, tiotropium. The explanation is as follows. Tiotropium is a long-acting muscarinic antagonist, LAMA, that is commonly used in the management of COPD. It helps by relaxing the airway smooth muscle, improving airflow, and reducing exacerbations. Here is the explanation for the incorrect options. Option A, glycopyrrolate is incorrect because, while it is a muscarinic antagonist, it is not commonly used in inhaler form for COPD. Option C, scopolamine is incorrect because it is used for motion sickness, not respiratory conditions. Option D, tropicamide is incorrect because it is used as an eye drop for pupil dilation, not for COPD. Option E, pilocarpine is incorrect because it is a muscarinic agonist, not an antagonist. Question 8. Which of the following muscarinic antagonists is commonly used as a pre-medication to reduce salivary and respiratory secretions before surgery? Option A, atropine. Option B, scopolamine. Option C, ipratropium. Option D, tolterodine. Option E, glycopyrrolate. The correct answer is option E, glycopyrrolate. The explanation is as follows. Glycopyrrolate is frequently used before surgery to reduce secretions due to its antimuscarinic effects. It is particularly advantageous because it does not cross the blood-brain barrier, minimizing central side effects. Here is the explanation for the incorrect options. Option A, atropine is incorrect because it is less selective and may have more systemic side effects. Option B, scopolamine is incorrect because it is more commonly used for motion sickness. Option C, ipratropium is incorrect because it is used for respiratory conditions like COPD, not pre-surgical preparation. Option D, tolterodine is incorrect because it is primarily used to manage overactive bladder. Question 9. Which of the following muscarinic antagonists is used in the management of overactive bladder? Option A, atropine. Option B, scopolamine. Option C, ipratropium. Option D, oxybutynin. Option E, glycopyrrolate. The correct answer is option D, oxybutynin. The explanation is as follows. Oxybutynin is specifically indicated for overactive bladder due to its ability to inhibit involuntary bladder contractions. It works by blocking muscarinic receptors in the bladder's smooth muscle. Here is the explanation for the incorrect options. Option A, atropine is incorrect because it is not used for bladder-specific conditions. Option B, scopolamine is incorrect because it is used for motion sickness. Option C, ipratropium is incorrect because it is used for respiratory conditions like COPD. Option E, glycopyrrolate is incorrect because it is used primarily to reduce secretions before surgery. Question 10. Which of the following is a selective M3 muscarinic antagonist? Option A, atropine. Option B, darafenicin. Option C, scopolamine. Option D, ipratropium. Option E, tiotropium. The correct answer is option B, darafenicin. The explanation is as follows. Darafenicin is a selective M3 antagonist that targets receptors involved in smooth muscle contraction, making it effective for conditions like overactive bladder. Its selectivity minimizes side effects related to other muscarinic receptor subtypes. Here is the explanation for the incorrect options. Option A, atropine is incorrect because it is a non-selective muscarinic antagonist. Option C, scopolamine is incorrect because it is used for motion sickness and is not selective for M3 receptors. Option D, ipratropium is incorrect because it is non-selective and primarily used for respiratory conditions. Option E, tiotropium is incorrect because, while it targets M3 receptors, it is used for respiratory diseases like COPD, not for M3 selective applications. As a form of recap, Take note of the following 4 tips to help you tackle similar questions effectively. The first tip is that understanding drug classes and their specific mechanisms of action is critical. Pay attention to how different drugs within a class function. The second tip is that certain keywords like except or most likely can mislead you if overlooked. Highlight these words during exams. The third tip is that knowing the clinical context, such as a drug's common use, e.g., tropicamide in ophthalmology, can guide you to the correct answer. The fourth tip is that practicing question analysis and eliminating obviously incorrect options systematically increases your chance of success. Conclusion. That wraps up our revision on anticholinergics. I hope you found this session insightful and engaging. For further reading, consider resources like Katsung and Trevor's Clinical Pharmacology, Rang and Dale Pharmacology, and the British National Formulary, BNF. If you enjoyed this video, please like, comment, and share your thoughts or questions below. Don't forget to subscribe for more content like this. Follow us on Instagram, Facebook, and Spotify for updates and interactive learning. Thank you for watching, and see you in the next video.